Well, good afternoon, everyone, or almost afternoon for folks joining from the West Coast. I'm Laurel Gillespie, and I'm the Chief Executive Officer of the Canadian Hospice Palliative Care Association. So, welcome to the Canadian Hospice Palliative Care Association ceremony celebrating the exceptional individuals who have been awarded the King Charles III Coronation Medal. Before we begin, I would like to acknowledge that the offices of CHPCA are based in Ottawa, Ontario, which is on unceded, unsurrendered territory of the Algonquin Anishinaabe people. And we recognize that many of you are joining us from different parts of the country and out of the country, and we honor the diverse Indigenous communities on which lands we live and we work. We are grateful for the generous sponsorship also of St. Elizabeth Foundation, whose support made this event possible, and their commitment to hospice palliative care across Canada is unwavering, and we thank them for their partnership. So it was due to them that we were able to send you your party in the box, which I hope you all did receive. I heard from many of you. But additionally, before we proceed, I'd like to take a moment to acknowledge the passing of one of our champions in our sector. The recent passing of Dr. Bernard Lapointe, a palliative care physician from Montreal and a past CHPCA board president who dedicated his career to improving end-of-life care in Canada. His contributions to our field are extensive, and his legacy will continue to inspire us all in the decades and generations to come. This medal actually that's awarded to you was created to mark the coronation of His Majesty King Charles III, recognizing individuals who have made significant contributions to their communities. We were invited to nominate 25 participants, and I must admit that it was a very difficult task. If it were up to me, we would have nominated at least 2,500 individuals, because there are so many of you out there that are doing amazing work and trying to ensure that everyone has equitable access to timely, quality palliative care. So Canada is home to so many dedicated professionals and volunteers who work relentlessly to advance hospice palliative care. And today we're honored to celebrate a select few who exemplify this dedication. With that, I would like to turn it over to our Master of Ceremonies today, our Board of Director from Saskatchewan, Cameron Choquette. Cameron?
Thank you, Laurel. It's my pleasure to be here on behalf of the CHPCA Board of Directors. My name is Cameron, and I serve as the board's secretary and treasurer. And it's really a privilege to be here on behalf of the CHPCA board and the SHPCA Board of Directors. The King Charles III Coronation Medal is a testament to the outstanding contributions of individuals who have made a meaningful impact in their communities. Each and every one of today's honorees has played an absolutely instrumental role in advancing hospice palliative care here in Canada, ensuring that individuals and families receive compassionate, high-quality care when they need it the most. These nominations were made possible through the collaboration of all of our hospice palliative care associations across the country, who helped us identify and nominate 20 of the most deserving individuals we could think of, whose dedication and leadership have been truly exceptional over the course of their careers. And the CHPCA team based in Ottawa also directly nominated 5 additional recipients. As we present each medal recipient today, we invite you to share your messages of congratulation or your experiences with the nominees in the chat today, so feel free to use that. You'll hear from board members from across the country. And first up, we're going to go to the East Coast. And I'd like to invite Jennifer Forward, CHPCA's Board of Director representative from Newfoundland and Labrador, to present our first award. Jennifer, over to you.
Good afternoon, everyone. It is my great honor to present the King Charles III Coronation Medal to an exceptional individual from Newfoundland and Labrador. Dr. John Campbell has been a key figure in advancing palliative care in Newfoundland and Labrador. As a founding board member of the Lionel Kelland Hospice, the province's first residential hospice, he has worked to expand access to compassionate end-of-life care leaving a significant impact on patients and families. As we recognize Dr. Campbell, I want to share a bit about his journey. Inspired by his mother, a palliative care coordinator, he began volunteering at Victoria Hospice during his undergraduate studies. This experience shaped his views on life, death, and the importance of compassionate end-of-life care. John, on behalf of the Canadian Hospice Palliative Care Association and the Newfoundland and Labrador Palliative Care Association, and with deep gratitude for your contributions, I am honored to present you with this medal. And now I would like to invite our representative from Prince Edward Island, Nancy Marie Arsenault, to introduce our next recipient.
Good afternoon, everyone. It is my pleasure to present the King Charles III Coronation Medal to a distinguished leader in our palliative care teams from PEI. Susan Doucette's journey into hospice palliative care began as a home care nurse, where she saw firsthand the importance of ensuring that no one suffers or dies alone. She became a leader in palliative education, developing training programs, leading quality care teams, and supporting the integrated provincial palliative program. Now a LEAP facilitator, she continues to enhance hospice palliative services across PEI. As we recognize Susan Doucette, I would like to share something she reflected upon learning that she was a recipient of the medal. It is a true honor to be recognized in this way. I am humbled by being chosen. I don't do the work I do for any type of recognition. My home-based care team, our island hospices, and everyone who provides and supports hospice palliative care across PEI have been an integral part of all the work I do. Susan, on behalf of CHPCA and us here at Hospice PEI, we thank you for your dedication and commitment. I now invite our representative from Nova Scotia to present the next award.
Sorry, I think that Mary Ann Arab, our board member from Nova Scotia, was having some technical difficulties today. So Nancy Marie, I'm happy to present that award to Mary Ann, or from Mary Ann on behalf of Nova Scotia, or unless you would like to proceed and continue. Up to you.
You go ahead and present, Laurel.
Okay. Well, actually, having been from back east, I guess it gives me honor and privilege to recognize an exceptional individual from Nova Scotia for her contributions to hospice and palliative care. Anne Forgeron Cosgrove is an Acadian Nova Scotian educator and advocate committed to expanding access to hospice palliative care, grief and bereavement services across Nova Scotia. She played a key role in securing $2.8 million in funding through Nova Scotia Hospice Palliative Care Association to enhance these services province-wide, ensuring culturally and linguistically appropriate resource for all Nova Scotians. Upon receiving this honor, Anne shared this message of gratitude. Volunteerism provides many opportunities to contribute at local, provincial, and national level. For these enriching experiences, I am most grateful. And on behalf of CHPCA and the Nova Scotia Hospice Palliative Care Association, we sincerely want to thank you for your dedication. And I would like to now invite our representative from New Brunswick, our Board of Director, Alain Roy, to present the next award.
Good afternoon. It is my pleasure to present the King Charles III Coronation Medal to a remarkable individual from New Brunswick. Dr. Pamela Mansfield has been a leader in palliative care in New Brunswick for over 17 years. Her dedication to ensuring accessible, high-quality palliative care service for patients, whether in their homes, nursing facilities, or hospitals, has been impactful. She has also been instrumental in advancing palliative care education for healthcare professionals and volunteers across the province. As we honor Dr. Pamela Mansfield, I'd like to share her thoughts on what this recognition means to her. This medal represents years of hard work and dedication to the field of palliative care, and I hope that all Canadians will have access to a good quality palliative care no matter where they live. Pamela, on behalf of the CHPCA and the NBHPCA, we sincerely thank you for your contributions. I now invite our representative from Quebec, Dale Wheel, to present the next awards.
Merci, Hélène. Il me fait immense plaisir de reconnaître 4 femmes d'exception du Québec pour leur contribution importante à soins palliatifs. Pionnière en psychologie palliative, Joanne de Montigny s'est dévouée pendant près de 30 ans à la formation et l'appui de psychologues, de patientes et de familles endeuillées, notamment ses réalisations au sein de l'équipe de soins palliatifs de l'hôpital Royal Victoria, en collaboration avec Dr. Balfour Mount, ont eux façonné la psychologie palliative au Canada. Alors que nous rendons hommage à Joanne de Montigny, j'aimerais partager avec vous quelques mots qu'elle a partagés à l'occasion de cette distinction. J'aimerais remercier les membres du comité de la QSP pour leur reconnaissance, ainsi que mon équipe de soins palliatifs, alors dirigée par Dr. Balfour Mount, pour son soutien lors de la mise en pied en 1988 de la psychologue de mourir et de deuil dans la première unité hospitalière de genre au Canada. Médecine de famille, spécialisée en soins palliatifs et gériatrie, Dr. Justine Farley a été chef de service aux soins palliatifs au Centre hospitalier St. Mary's à Montréal, a enseigné à l'Université McGill et pratique présentement en résidence pour les aînés. Vice-présidente de l'Association québécoise de soins palliatifs, elle est membre du conseil d'administration de l'Association canadienne de soins palliatifs et préside le congrès de la QSP depuis 2018. Alors que nous rendons hommage à Dr. Justine Farley, j'aimerais partager avec vous quelques mots qu'elle a partagés à l'occasion de cette distinction. Cette médaille confirme l'importance que le Canada accorde aux soins palliatifs. Elle souligne la valeur de mon engagement auprès des personnes souffrant et de leurs proches. Je souhaite que les soins palliatifs deviennent accessibles à toutes les personnes qui peuvent en bénéficier, soins offerts par des professionnels, médecins et bénévoles compétentes. Dr. Louise Lafontaine, médecine diplômée de l'Université de Sherbrooke, est une leader active dans le secteur des soins palliatifs de Québec. Elle est cofondatrice de la Maison des soins palliatifs de Bas-Saint-Laurent et a initié la Coalition du Québec pour l'accès aux soins palliatifs et a créé le premier service universitaire en soins palliatifs à l'Université de Sherbrooke. Elle sert aussi comme présidente de l'Association québécoise de soins palliatifs depuis 2017. En recevant cet honneur, la docteure Lafontaine a fait part de quelques mots de reconnaissance. Je souhaite remercier toutes les personnes qui ont appuyé cette reconnaissance à mon endroit, particulièrement mes collègues de l'AQSP avec qui je partage cet honneur. Cette médaille, je n'aurais pu la recevoir sans l'ensemble de personnes qui m'ont entouré, mes proches, mes collègues et les personnes malades qui sont la source de mon engagement. Leader et visionnaire auprès des soins palliatifs pédiatriques, Michelle Biot-Chagnon a cofondé le FAIR Enfants et Familles, la première maison de soins palliatifs pédiatriques au Québec. Elle a été une ardente ambassadrice et militante pour les familles qui requièrent des soins palliatifs pour leurs enfants. À la suite de l'annonce qu'elle est récipiendaire de cette médaille, Michelle a partagé quelques mots. L'attribution de cette médaille représente pour moi la reconnaissance de mes pairs et c'est ce qui me touche le plus. J'ai travaillé toutes ces années à la promotion des soins palliatifs pédiatriques avec un groupe de personnes qui y croient autant que moi et qui ont aussi contribué à promouvoir ces soins. Joanne, Justine, Louise et Michel, au nom de l'Association canadienne de soins palliatifs et l'Association québécoise de soins palliatifs, Nous vous remercions infiniment pour votre dévouement infatigable. Je souhaite maintenant inviter notre représentante de Ontario pour présenter les prochaines médailles. I now invite our representative from Ontario, Christine Gordon, to present the next awards. Thank you.
Thank you, Dale. It is my privilege to recognize 6 outstanding individuals from Ontario for their contributions to hospice palliative care. Dr. Darren Cargill is a Windsor-based palliative care physician and advocate. He served as medical director at the Hospice of Windsor and Essex County for 16 years and helped to eliminate the 3-month wait for OHIP coverage for palliative patients through Dan's Law. His leadership continues to shape palliative care in Canada. Dr. Darren Cargill shared the following thoughts upon learning he was a recipient of this honor. I cannot accept this award without acknowledging the Hospice of Windsor and the fine work it does for patients and families in Essex County. This medal represents an opportunity to reflect on the breadth of work done to improve access to palliative care in Ontario and across Canada. Dr. James Downer is a critical care and palliative care physician in Ottawa. He is professor and head of the Division of Palliative Care at the University of Ottawa and co-chair of the Pan-Canadian Palliative Care Research Collaborative. His research has shaped communication, decision-making, and palliative care across Canada. As we recognize Dr. James Downer, I'd like to share a few words he expressed upon receiving this honor. I would like to thank my family for their support and love, my mentors and teachers for their time and help, my colleagues for their hard work and dedication, and my research team for working so hard to find new and effective ways to improve the lives of people who are dying. This is a real team effort. Tracy Human is a dedicated leader in palliative care, committed to ensuring quality end-of-life support. With over 40 years of experience, she has shaped palliative care education, mentorship, and advocacy, supporting care providers across Ontario and internationally. As we celebrate Tracy Human's contributions, I'd like to share the heartfelt words she expressed upon receiving this honor. To Jesus Christ, the Governor General's Office, CHPCA, and HPCO, thank you. With deep gratitude, I dedicate this to my parents, my family, my mentors, my colleagues, and the individuals and families I have had the honor of caring for. Dr. Vivian Papez is an esteemed nursing leader and educator, serving as Associate Dean for the School of Health Sciences at Canadore College. With extensive experience in palliative care, she has championed education, policy, and governance at national and provincial levels, advancing end-of-life care across Canada. As we celebrate Vivian Papez's contributions, I'd like to share the words she expressed upon receiving this honor. I am honored and humbled to have received this medal. It holds significant meaning for me, celebrating the values of service, dedication, and community. I am reminded of the importance of continuing to serve with integrity and purpose and committed to upholding the ideals represented by the medal. Dr. Holly Prince is dedicated to advancing culturally appropriate and equitable palliative care for Indigenous communities. Her work focuses on ensuring equitable access, supporting Indigenous-led approaches, and advocating for the rights of Indigenous peoples to receive culturally safe end-of-life care. In recognizing Holly Prince, I'd like to share a reflection she offered upon receiving this medal. I want to say miigwech to the incredible team at the Center for Education and Research on Aging and Health at Lakehead University. Your commitment to improving the care of Indigenous peoples is inspiring. I also want to honor the elders who have shared their wisdom with me. Your teachings have greatly influenced my journey, and I am truly thankful. Rowney Salmonen is the founding member of Philip Aziz Center for Hospice Care and the founder of Emily's House, Toronto's first pediatric hospice. Her leadership has shaped hospice palliative care, ensuring compassionate, community-based support for children and adults. It is a privilege to acknowledge Rowney Salmonen today, and I would like to share the heartfelt words she expressed upon receiving this honor. I am grateful and honored to have been nominated for the King Charles III Coronation Medal. A huge shout out of gratitude to so many compassionate and skilled colleagues, staff, volunteers, and patients who have been my mentors and relentless leaders in advancing palliative care. Darren, James, Tracy, Vivian, Holly, and Rowney, on behalf of CHPCA and HPCO, we thank you for your ongoing commitment to hospice palliative care. I now invite our representative from Manitoba, Genevieve Thompson, to present the next award.
Thank you so much. It is my privilege to recognize an outstanding individual from Manitoba for his dedication to hospice palliative care. Dr. Mike Harlos has been a leader in palliative care for nearly 3 decades. His work in both pediatric and adult palliative care has been instrumental in improving access to compassionate end-of-life care across Manitoba. As the first medical director of palliative care for the Winnipeg Regional Health Authority, he has shaped programs that continue to support patients and families in need. As we honor Dr. Mike Harlos, I'd like to share a few words of gratitude he expressed upon receiving this honor. The incredible colleagues and clinical teams I worked with over the years were the foundation for anything I was able to accomplish in palliative care. I am deeply grateful for the support of my family throughout a busy career. Mike, on behalf of CHPCA and Palliative Manitoba, we thank you for your remarkable contributions. I now invite CHPCA Secretary Treasurer from Saskatchewan, Cameron Choquette, to present the next award.
Thank you, Genevieve. Dr. Vivian Walker has dedicated over 40 years to family medicine, cancer care, and palliative care. She played a key role in establishing Saskatchewan's first freestanding hospice, ensuring compassionate end-of-life care for patients across Saskatchewan. Recognizing Dr. Walker is a sincere pleasure for the Saskatchewan Association, as she's a real institution here in our province. And she had this to say. Growing up in rural Saskatchewan, she was deeply influenced by her parents. Her father, a neurologist, and her mother, a no-nonsense registered nurse. Their dedication to service shaped her path in medicine, and over her 40-year career, she's worn many hats in healthcare, but palliative care has been the most meaningful to her. Her guiding principle has always been the words of Mother Teresa, "We can do no great things, only small things with great love." Vivian, on behalf of CHPCA and the Saskatchewan Hospice Palliative Care Association, thank you for your remarkable dedication to our province and the people that call it home. I now invite our representative from Alberta, Amber Thibault, to present the next award.
It is my absolute privilege to recognize 2 exceptional individuals from Alberta for their contributions to our hospice and palliative care. The first, Elaine Klein, has dedicated over 35 years to hospice palliative care as a nurse, educator, and advocate. She has worked in both Ontario and Alberta, advocating for equitable access to palliative care, collaborating with community leaders, and ensuring high-quality care for patients and families. Her leadership with the Alberta Hospice Palliative Care Association has ensured the organization's continued impact, and her efforts in bereavement leave advocacy have influenced national policy change. As we acknowledge Elaine, I'd like to share a reflection she offered upon receiving this honor. I would like to thank CHPCA, AHPCA, and the patients and families who have allowed me to walk with them on their journey towards death. I've learned more from you than you have from me. This medal is an honor. And the second recipient, Dr. Donna Marie Wilson, has dedicated her career to advancing hospice care throughout research, education, and advocacy. Her work has shaped policies that improve end-of-life care, ensuring greater accessibility and quality for those facing life-limiting illnesses across Canada and around the globe. As we recognize Dr. Wilson, these are a few of her words she shared upon receiving this honor. I have never sought public recognition for my work, but as I near the end of my career, this medal solidifies my efforts to help improve end-of-life care. I am deeply indebted to the many people and the organizations who have helped me grow and carry out my life's work. Elaine, Donna, on behalf of the CHPCA and the AHPCA, we thank you for your incredible dedication. I now invite Cameron back for the British Columbia Awards.
These next two individuals, all the way from the West Coast, are being recognized for their outstanding contributions to hospice palliative care. The first being Dr. Fraser Black, who has dedicated nearly 30 years to palliative care, supporting underserved populations and providing outreach services for patients facing barriers to care in Victoria. His work has improved palliative care across the communities and around the world, ensuring compassionate and dignified care for those in need. He had this to say when he received the honor. Receiving this award is an incredible honor and a recognition of what I hold dear. It also represents a collective effort of those who have been on this journey with me to try and improve access to quality and compassionate palliative care in Canada and internationally. Dr. Shannon Freeman is an associate professor at UNBC School of Nursing, specializing in palliative care and aging in rural and northern communities. Her research improves quality of life for vulnerable populations, and she's committed to advancing equitable access to palliative care across our country. She had this to say when learning that she was awarded the medal. This means so much to recognize the value of research to inform and support persons nearing end of life. We share the goal to increase the quality of life for all individuals, including the person nearing the end of life, their family, their care partners, and the health system which supports them. Fraser and Shannon, on behalf of the Canadian Hospice Palliative Care Association and the BC Hospice Palliative Care Association, we extend our heartfelt thanks and congratulations for your contributions. I'll now invite Laurel back to the stage to present the recipients nominated by the Canadian Hospice Palliative Care Association. Laurel?
Thank you, Cameron. I'm fighting back some tears, actually. I just want to get this out there that having been bestowed the responsibility of leading this organization across Canada, it's not an easy feat. But I'm overwhelmed by the magnitude of the work that's being done in this country, often without a lot of gratitude and thanks for people who are outside of our world, outside of palliative care, to really truly understand the dedication and the passion that all of you award recipients have demonstrated. And one of the highlights of my terms with CHPCA was actually getting the privilege, or having the privilege, of calling each and every one of you to share a few moments and letting you know that you were receiving this medal. And I'm just so grateful to all of you for actually allowing me to be in this position with a great team at CHPCA. That, you know, it's just such a privilege to share this time. And I hope that everyone is feeling honored, respected for doing what you do. And I thank you as another person, but also to have the privilege of working alongside of you. So I wanted to begin this portion by extending our deepest gratitude to the Provincial Hospice Palliative Care Associations for their efforts and work to identify and submitting such outstanding nominees. As I know with my team and myself that it was not an easy feat to look across this great country and only be able to choose 25 outstanding contributors. But having said that, the team and myself are delighted to represent or to present the King Charles III Coronation Medal to a distinguished group of individuals nominated directly by us for their remarkable contributions to hospice palliative care in Canada. Dr. Christopher Klinger is an assistant professor at McMaster University and a leader in hospice palliative care research. He chairs the National Initiative for Care of the Elderly, End of Life Issues Theme Team, and co-chairs the Palliative Care Coalition of Canada's Research Committee, advocating for evidence-based improvements in end-of-life care. Christopher Klinger shared these thoughts upon learning he was a recipient of this honor. I am honored and moved to receive this recognition. The hospice and palliative care fields have evolved also through research and quality improvement, but there remains a need for further growth to support all people with serious illness and their families. Zelda Freitas is a dedicated social worker, educator, and clinical advisor specializing in caregiving, palliative care, adult mistreatment, and end-of-life support. She actively collaborates with communities to enhance resources for caregivers and advance best practices in social work and palliative care. Zelda wanted to share these reflections when she received the news of being bestowed this honor. Receiving this medal is a special honor as a social worker in the social work profession, as it recognizes our dedication and ongoing advocacy to improve care to individuals living with advanced illnesses and their caregivers in a collaborative approach that includes those with lived experiences. Dr. Christina Vadaboncourt is a professor of pediatrics at the University of Ottawa and medical director of palliative care at CHEO, the Children's Hospital of Eastern Ontario, and Roger Nielsen's Children's Hospice. She advocates for pediatric palliative care through research, leadership, and education, ensuring compassionate support for children and families. Dr. Vadaboncourt reflected on this recognition with the following words: I am honored by the recognition this brings to the field of pediatric palliative care. I hope that every individual who would benefit from hospice palliative care is able to access it, both by being comfortable to ask for it and for there being experienced people to provide the care. Dr. Bruce Martin. Dr. Bruce Martin has dedicated his career to advancing palliative care in Northern and Indigenous communities. With decades of experience in family medicine, education, and research, he has worked extensively with First Nations and Inuit communities, advocating for equitable access and culturally safer end-of-life care. Reflecting on his honor, Dr. Martin shared these thoughts. I am humbled by the recognition bestowed upon me and grateful to those who have honored my commitment to holistic care. I am hopeful that health system leadership and health provider educators will reflect upon and address the need for equity and access to high quality, collaborative, and culturally safe hospice and palliative care from coast to coast to coast. Oh, oh boy. Serena Lewis is a social worker, educator, and speaker with over 20 years experience in health, education, and community sectors. She has been a strong advocate for grief literacy and bereavement support, particularly following the 2020 mass casualty event in Nova Scotia. Serena Lewis wanted to share this message with you all upon receiving news of this honor. I am honored and humbled to be a recipient of this medal. I recognize that it does take a village to support death, dying, and grief. I am grateful for the mentors, colleagues, individuals, and families that I have worked alongside who continue to teach and support my personal and professional growth. Christopher, Zelda, Christina, Bruce, and Serena, on behalf of the Canadian Hospice Palliative Care Association, we sincerely thank you for your dedication and impact in palliative care. Today, as we look and reflect on the inspiring stories and remarkable contributions to all of our honorees today, we are reminded of the spirit of dedication that drives hospice palliative care forward in Canada. This moment of recognition is not just about individual achievements, but about the collective effort that ensures quality palliative care is accessible to all. Cameron, I'm going to turn it over to you at this time. But before I do that, I am really overwhelmed right now. This is such a privilege to be able to share and to come together as a united country with such dedication and passion to making our society and our communities stronger and treating each other with dignity and respect. So just with so much gratitude to all of you, your families, any of the dignitaries that were invited who have participated to celebrate with us today. Just an extreme amount of thank you goes out to all of you. And I hope that everyone is able to conclude today's event with celebrating with your families, loved ones, your chosen families, your colleagues, and anyone who has been alongside you on your journey in palliative care. Cameron, over to you.
Well, folks, as we conclude our ceremony, another heartfelt congratulations to today's recipients. Your contributions have made a lasting difference in the lives of countless individuals and families across Canada, and your legacy lives on through the systems that you have impacted each and every day of your career. We extend our gratitude to all of our provincial associations for their collaboration in identifying this truly exceptional group of people. And thank you as well to our event sponsor, St. Elizabeth Foundation, for their generous support. We couldn't have done it without you. And thank you to everyone who joined us today. It's an important day to recognize these tremendous individuals, and it's an important day to motivate us to continue working together to ensure that compassionate, high-quality hospice palliative care remains accessible to all who need it. Laurel has the last word today, but on behalf of the Board of Directors, my sincere appreciation to her and her tremendous team. Based in Ottawa, they champion hospice palliative care across the country, and they do it around the world as well. And Laurel was recently in Geneva speaking on behalf of Canada and representing us so very well. So Laurel, on behalf of the board, congratulations on a successful event today. Last word to you.
Thanks so much, Cameron. I wish to personally thank everyone for joining us today to celebrate these incredible human doers. We're not just human beings. This is an exceptional group of human doers who are getting the hard work done. So thank you for joining us today to celebrate all of you. We hope that their stories have also inspired you to make your own mark in your own communities and to strengthen compassion and care for those facing serious illness, caregiving, or grief. As so many of today's recipients have expressed, palliative care is a team sport, and it truly does take a village. So thank you for being that village. To our medal recipients, we hope you enjoy the special gift boxes that were sent to you as a small token of appreciation for your contributions. Today is about celebration, so please take this moment to share it with your loved ones and reflect on your achievements and celebrate big. I did have a confetti bomb to pop off, but then I decided I didn't want to have to clean up pieces of paper for the next 2 years. But I'm going to bring it to Nanaimo in October. So maybe for all of you that are planning on attending and meeting us in October in beautiful British Columbia on Vancouver Island for our biennial conference, happy to bring my hat. and share a picture and actually present you or do a photo opportunity that can go along with your medals to pass along for generations to come of acknowledging all of your hard work, if that's important to you. But thank you again. And thank you for the team and supporting this endeavor. A lot of work went behind the scenes. And I just really honestly and sincerely hope that you do feel honored, recognized, respected for all of your hard work and your contributions. And it's been such a privilege to speak with all of you and honor your incredible work. So we wish you a wonderful rest of your day and evening coming up. And we hope you have a beautiful meal tonight and break bread and just celebrate the joy of being wonderful human doers that you are. Congratulations once again to all of our honorees. Thank you.